Should I really need to have revision? It's been 3 months after I had Asian double eyelid surgery. My two eyelids are obviously different in size, and all the swelling is gone. Even the doctor admitted that they are different. I can wait a month and have a revision, but I am concerned if the surgery will be successful or not, because the difference is not very big, so it is quite risky. I am afraid that I will end up having two even more different eyelids if I have the revision. Help. What should I do?
Thank you for your question. You submitted your question with the photo, and you state that you are now 3 months out after undergoing Asian eyelid surgery. And you are stating that the eyes look different enough that your doctor agrees with you, you feel like the swelling has resolved, and that you are planning to undergo a revision procedure in 1 month. I think you're concerned about the complications and maybe having even a greater asymmetry after the procedure, and so you're looking for some guidance as to the course of action to take. Well, I can certainly share with you my discussions with patients who are considering enhancement of the surgery, whether it's Asian or non-Asian eyelid surgery. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform all types of Asian eyelid surgery, especially when you talk about the upper eyelids. This includes incisional, where skin is removed, and non-incisional, which is done with sutures, and as well as all types of non-Asian eyelid surgeries, as well as complications and revisions. So certainly this is a discussion that we have routinely, often regardless of outcome. I think that one of the things that we always have to keep mindful of when you're trying to make a decision like this is, what did you look preoperatively? How do you look postoperatively? And is the feasibility of getting the outcome that you want of relatively low risk? And that's the question that you and your doctor have to discuss. In our field, it is often stated by many of my colleagues that the enemy of a great result or a good result is a perfect result. And there is, in fact, certainly a point of diminishing returns when you try to keep going after an ideal and a perfection. I always explain to our patients that normally in life there are certain levels of natural asymmetries. I say that we are beautifully imperfect and that no one has a perfectly symmetric face. And when it comes to Asian eyelid surgery, certainly it's important to appreciate the degree of difference that you want to achieve. When I look at your photos, to me the right upper lid area, there still is a little bit of swelling, and it may not be that significant, but it might be relevant in terms of your planning. I recognize that in the left upper eyelid, the crease just kind of fades out as you go away from the inner part of the eye, so it's not as deep. So I would suspect that an enhancement procedure, if this were a non-incisional Asian eyelid surgery, would be relatively straightforward, where there would be simply the application of local anesthetic, the placement of the anchoring sutures, and then completion of the surgery, which can probably not take very long. I would categorize that as a relatively low risk. I think that this is a discussion for you and your doctor. I think any doctor who performs any surgery with any consistency is going to be familiar with the need for enhancements. One of our more famous colleagues in our specialty said that any surgeon who claims never to do enhancements is either lying or just doesn't do surgery. So it's part of the plastic nature of cosmetic surgery is that we're dealing with some variability of the soft tissue, where we are trying to do things as predictably as possible. Sometimes the eye socket anatomy is not going to be as cooperative. Sometimes the skin doesn't cooperate with your intended plan. Sometimes it doesn't heal as predicted. These are just part of the realities of what we do. So I think that it's important for you to have this discussion, and again, an ideal situation where an enhancement can really make an impact is when the procedure is going to be not that extensive and with a high likelihood of having the desired outcome. So discuss this with your doctor, and hopefully you'll be able to come to terms with what is the best course of action to take moving forward. So I hope that was helpful. I wish you the best of luck. Thank you for your question.